Thank you for joining us today for another edition of Conversations with AARP. I'm Troy Deshabert Schuster, your host and State Director for AARP in the Virgin Islands. Today's show is particularly significant as we will be speaking with the Honorable Albert Bryan Jr., Governor of the Virgin Islands of the United States. He will be sharing his insights from the 2024 State of the Territory Address and discussing his future vision, particularly in light of our rapidly aging population, a topic of priority for AARP. The 2020 census revealed that over 1/5 of our population is 65 or older, marking a significant shift in our demographics. As we face this change, questions arise. How will our elected leaders plan to address our healthcare, housing, and infrastructure to meet their needs? Today, Governor Bryan addresses these vital issues, exploring his plans for 2024 and beyond, with our mission of creating a more livable community for all ages. We look forward to an enlightening conversation with Governor Albert Bryan Jr. as we talk about the path towards a vibrant and inclusive future for the Virgin Islands. And so we welcome Governor Bryan. Governor, welcome to the show.
Thank you, Troy. It's a pleasure to be here. Always a pleasure to speak with AARP. You've done such incredible things in the territory and have been such a vital partner to the administration. I just really want to publicly say how pleased we are with your service and the stuff that you're doing, not only for our seniors, but for our communities in general.
And thank you so much for allowing us to be a partner of the government of the Virgin Islands. I always tell my AARP colleagues all across the country that I take a slightly different approach. I seek to be a partner with the governor and with his administration, or her administration, as the case may be. In some states, we do have female governors, so that we can work together, and it makes the whole advocacy process that much easier. And all of your departments are always so welcoming to AARP. Many times I said to them, I feel like I work for the government of the Virgin Islands, even though I've never worked for the government one day in my life. But it's such a welcome that I receive in AARP. So it's really wonderful. So thank you again.
You know what the funny part about it is, most of us are members, whether by default or actual card-carrying members like myself. So, you know, I remember being a young man and constantly being told by my seniors all the time, you know, eventually everybody gets old, you know. So it's good to be an advocate and understand the issues about so many things that are going on in the Virgin Islands and being able to support our aging community. The median age in the Virgin Islands is somewhere around 55 or 56 years old at this point. And while the administration has been very successful at lowering the age of government, we have an actually lower median age. We didn't talk about that last night. There are a lot of good things that are happening for our community as they age. And one of the things I'm trying to shift in not only my commissioner's mind, but in the community's mind, is that 70-year-olds work now. And what it used to look like before, like when people think about seniors, they think about people walking around with canes, or who are bedridden, or, you know, or hospitalized in some way. And that's not what, you know, active living as a senior is now. I mean, for myself, I mean, I'm 56 years old next month, and I still want to be active. That is why we create programs like Our Best Life, because living your best life around senior living and enjoying the Virgin Islands, because we know that active minds and active bodies not only improves your health, but it prolongs your life, prolongs your memory, keeps you more engaged as you age in our community.
Now, you just said a whole lot at that moment. And first of all, you said that people 70 years of age are still working. So first of all, do you have plans for helping those who are beyond 65 to re-enter the workforce? And secondly, tell us about that program, Our Best Life, that you just mentioned.
So first of all, I mean, one of the major things that we worked on in the administration was actually allowing people to return to work after they've retired for the government. So we finally got those rules promulgated. We're going to be talking more about it this year, that you could actually work for 3 years, right? And still collect your retirement while you're taking a government salary, which is a which is a tremendous benefit to the government because right now we need the expertise. I mean, people my age are retiring, 55-year-old, 54-year-olds, done 30 years in the government already and are retiring. And when they leave with a lot of expertise from the job. And then we got to train up to get back to that level again. It's not, the succession planning is not always smooth. Secondly, you're getting two salaries. And, listen, last night, the 20% inflation that we had in the last 2 years alone is really worrisome to me. It is a clarion call to those of us that are still strong and are available to work, that you need to keep working and you need to save and you need to start planning. Which our retirement GRS, we've been having conversation with them. They're going to start doing some stuff. We could talk about that later, but being able to now bring two salaries into your household to kind of save some money, invest some money, pay down your mortgage or whatever it is that's keeping you back. And then our best life is about really living your best life. COVID put a lot of seniors in very precarious situation. I think people have selective amnesia. If you're over 65, in the Virgin Islands when COVID hit. It was very, very, I mean, it was scary for everybody, right? But here they are telling you you're the most vulnerable population. So our seniors, the older you go, the more isolated they became. I mean, there was a point in COVID when you don't even want to go visit your grandmother or your senior friend because you wouldn't want to be guilty of giving them the COVID and them having some kind of complication, and whether they're sick a long time or they die, you don't want to be responsible for that. So getting them back outside, sponsoring walks, sponsoring different activities. We had during the campaign, we had tours for senior, just going to the normal thing, just getting people active uh, is very important. We had classes, Calvert and the Department of Health did a good job of putting on exercise classes. We right before COVID, we actually had the exercise module that we have down in Lagoon that AARP helped us put up. The benches for when you're walking on the bypass to be able to stop and get a rest. Those things are like important to keeping your heart pumping, keeping your mind active. And then if you pay attention, the seniors want to speak to one another. They don't have places to congregate. So whether it's at the bank or the post office or in the shopping malls, they find some place to sit down where they could chat. Getting them out and together gives them an extra access. We also invested in training seniors how to use computers, how to use Zoom, and AARP was a big part of that, giving that education, because that's the only way you have to communicate. And, for years, people were saying, well, oh, I'm too old for that, or I can't do that. People wanted to talk to their grandchildren, and when they realized they could see their grandchildren using Zoom and using the computer, they were right on a bus. Like, I want to get on a bus. I want to be able to do that too. So for me, when we had the campaign, to see my seniors logging in to Zoom prayer meetings, which is fabulous. So tremendous amount of growth for our seniors. Lastly, I want to talk about housing. So the largest part of our housing plan is senior housing. So a large percentage of the new housing that's being built is senior housing, whether assisted or independent living. A lot of one bedrooms, because that's, you said it earlier. It's like we have an aging population, and we want to be able to subsidize their housing as they get older. You think about government workers, but what about that young lady or young man that went to work on Main Street when they were 20 years old and now they're 60? They might be healthy, but God forbid something happened to them and they lose a job. Most of those jobs don't have pensions. They got to depend on Social Security for a livelihood, or their family members. We have so many boarders that are left at the hospital, and I know people don't want to leave their mother or their father, auntie at the hospital when nothing is wrong with them. But they don't have the resources to take care of them. So we're working on a plan now where we actually have a private 100-bed assisted living skilled nursing facility that we're doing. We're assisting the private sector. We're doing one in St. Croix and hopefully another one in St. Thomas. And we're also working on a Herbert Grigg, which is a 60-bed facility, and Queen Louise and St. Thomas was a 60-bed facility. So we got to figure out a way how to allow for our seniors to stay in the Virgin Islands and not have to move them to the mainland to a nursing home because we don't have the facilities, and be allowed to make room in the hospital so we have borders. If you don't understand what I'm talking about, people sometimes they get sick but nothing's really wrong with them. They get cured there in the hospital, but the family can't take them home because they don't have anybody to mind them, or they're not sure they could give them the care that they need. So they leave them in the hospital. So we have to have places to put those people to because we need the hospital bed. So a lot of things happening around planning for the advent. And as you know, the largest generation ever is retiring and they're getting older and older, which is the boomers. So like I know this is an AARP show, but when young people see these type of interviews, I always tell them this is where the opportunity is for the future. Nursing, physician assistants, geriatric training and care, anything around home health care for our seniors is going to be a lot of work because you have this generation that's going to live longer, but there's no guarantee that they're going to be living that life, healthy and outside. They're going to need assistance, not only from the aspect of being living in our community, but we're a tourism destination. So all these people want to travel. That's why, we're putting in, if you go to Megan's Bay, I think in St. Croix, Kramer's Park, we're going to have it. I think it's in Frederickson as well, too. You could actually have wheelchair access down to the beaches. Our goal is to have that not only for people who just disabled, but for people who have difficulty in walking and stuff as they come on cruise ships or they live here on the islands to be able to access our beautiful waters. So a lot of things that we're doing very silently and we don't really advertise it about it. But Troy, because you work very closely with Julian and Eddie out of my office, making sure that we have accessibility for our seniors.
Last night you spoke about insurance for individuals who don't work for companies, which is wonderful and very, very important. But what about long-term care insurance? That's available throughout the United States, but it's not available here. I've brought it up to the Lieutenant Governor's office.
Mm.
Is there any thought about long-term care insurance to help to pay for some of the costs of home health care as people age before they even get into a nursing home or into a hospital?
I haven't, excuse me, thought of that. But I mean, you bring up a good point. I need to go talk to him about that and about, I, we have a lot of laws in the Virgin Islands that were put in place long ago to make sure that local competitors had an advantage of people coming in banking and insurance, dentistry, a lot of the trades, how you get your license, whether your license is transferable and whatnot, are issues. One of the things that I want to do this year is go back there for banking as well as insurance to try to see like what are the things in our law that are prohibiting people from participating because that's news to me. I mean, why wouldn't you be able to buy insurance? The other thing too is, I wanted this for years and I haven't been able to get it done. Is to be able to give people that insurance when they're working, because just like we have 50-year-olds that are retired, we have 70-year-olds that are still on the job. So if you have some type of catastrophic illness or something, I want it to be so that your insurance picks up that tab because with the government the way it's set up now, you could be on the payroll for years because of the donated leave program, which is great for you because you're getting a salary while you need the care. But then we can't replace that position because we're paying you out of the salary that would have been paid for this person. So being able to navigate some of those insurance issues, and that's a good one. The long term
Long-term care,
care.
yes.
Yeah, I'm gonna get with the lieutenant governor again now because I mean I have friends that are going through this now, right? Some of them are fortunate enough to live in the states where they're moving their parents close to a nursing home, close to where they live. But then you have people who don't even have the means or don't have people living in the States where they could do that. And even with that, right, you would figure, I mean, I have a friend, their mom had a decent salary, retired at a decent amount of money, getting Social Security, but they depleted all her savings trying to keep her in this
Hmm.
nursing home. And then they started digging into their personal savings
Right.
to be able to try to provide support to their mom. So it's a that's a serious economic impact on any family. But you got to do it. You
Yeah.
know, you got to do it if you can, or some people can't. You know, so thank you for that nugget.
Yeah, we really, really need that here. So I'll continue to follow up with you and with the Lieutenant Governor to see how we can get long-term care insurance here in the Virgin Islands. Now, during the pandemic, we talked about that a little while ago. We saw the importance of telehealth or telemedicine, where people could
Yeah.
not come out of their home or were afraid to come out of their home, and they were still able to have doctor visits. But technically, it's not allowed here in the Virgin Islands. What are your
Right.
thoughts on telehealth and the future of that for us here?
So we've had now two health technology summits. We actually have health information um, division within the office of the governor. It's run by Michelle, and she's doing an amazing job in bringing this to fruition. Now we need some legislation around it, but believe it or not, we actually have telehealth facilities at the MCH clinics. They've been operating telehealth now for at least like a year, being able to see patients remotely. So you go into the office and they have specialists in the States that you can consult with. And so we need to get a lot more of the legislation written around that. We've also the electronic health records. We're making some fabulous progress on that now. Like remember when the storms, how we lost all those people? Well, now we have a system in place now, so that could never happen again. You would also be documented. But the health records, which we are funded and working on with the Department of Health and the Office of Health Information Technology, that actually is a program where no matter where you go in the world, you'll be able to get a doctor to access your electronic health record. We have a program that we're going to be launching soon where we're using the watches like the iWatch
Mhm.
or whatever for the, you know, you get that. It monitors your blood pressure, it monitors your sugar and your glucose levels. So running programs now, like people talk about Life Alert, we're going to be giving people these devices. So you wear them. So if something happens to you, the watch will automatically tell somebody your pulse stopped or your sugar is high today. So we actually have monitoring that actually leads to better health outcomes. This program is running in DC out of Howard University. We have a very close working relationship with them. And my good friend Luigi, who is connecting us with a lot of these things. When you think about what we're doing, I mean Michelle in Office of Health Information Technology is doing an awesome job, and she's working closely with Dr. Hunt. They got some big Dr. Ty Hunt, amazing, another amazing version out of. Got some big announcements coming up soon around the med school and the stuff that we're doing there. All these things tie into a healthcare network. But the most important thing, like you know, Troy, is how do we keep people out of the hospital? And that's what we want to get. And then how do we create more access to healthcare? So part of that is bringing on companies like Caribbean Risk Group. So now an individual without belonging to anything could buy health insurance, but it's very expensive. So what would we done? We've expanded Medicaid and Medicare to cover a lot more things than it used to. And right now we're fighting to get to DC to get the cap. So we only can spend $135 million a year with Medicaid. That's our cap. Like states don't have caps, we have one. We need to get that raised to about 140, 150 million because we're at like 129 butting up against that now. After the after COVID, a lot of people are gonna come off of Medicaid because of the financial numbers, and we had expanded Medicaid because of COVID. But we still need the money because people need to get care. And then what we've done too is we took out some of the referral process. So as a Medicaid recipient, you could go to more providers and stuff in the Virgin Islands. So that a lot of little things that we don't talk about in the state of the territory that we're working on, and it's really challenge to keep a control of it all. But it's gonna get done. The other thing that home healthcare is another thing that we've been trying to expand on to be able to go and administer care in the homes. Um, and coming to hospitals and clinic exposes our seniors to all kinds of germs. You don't really want that. You'd be able to go in and see them in the home, monitor their blood pressure, be able to administer medication. That is good for us and it's good for them because it keeps you out of the emergency room and it keeps our seniors protected from getting exposed to stuff like COVID and RSV and all kinds of other stuff that's lurking in those medical facilities.
Talking about wellness and getting people exercising and moving and outdoors, there are many initiatives, but there's one that I want to bring to the forefront, and that's the Complete Streets policy that AARP worked on and had instituted here a couple of years ago. And part of Complete Streets is making sure that we have sidewalks that make sense, sidewalks that are accessible to people in wheelchairs or women or fathers pushing babies in a stroller or somebody in a walker, that we have proper crosswalks, et cetera, et cetera. But part of this Complete Streets policy was the establishment of a Complete Streets task force within the Department of Public Works. And that hasn't come about yet. We've been working with the commissioner and with the Walkability Institute, which is now housed at UVI. So I'm putting a plug for that, for you to help us to move that forward, to get the Complete Streets task force stood up within the Department of Public Works so we can take a closer look at streets. And it doesn't mean that we want the government to go back and retrofit every single street and put
Right.
sidewalks everywhere, because we know that's not feasible, right? We know that's simply not feasible. But what it means is that as streets are touched, as they are repaired, or new streets built, as the case may be, that we make sure that they are complete. And this enhances walkability, right? It gets people out.
Right.
Commissioner Encarnacion, she started the Walkability Institute within the Department of Health, and we partnered with her on that. It was a great, great partnership. So I just want to keep that momentum going. Your administration has done a lot already with walkability and complete streets. So we want to just keep that going, get that task force stood up, and make sure we have more complete streets in the VI.
Well, now is the time to do it, right? Because we're doing so much repairs. I mean, we just did some in Frederickstead, some those old sidewalks are falling in now. The galvanized that they used to keep them up is falling in and clogging the drains. So we redoing Public Works is actually doing sidewalks. I walk Christianstead often exercising. So a lot of the sidewalks, we cut out the trees and repair them. And then since then, Public Works has been pretty aggressive moving, repairing sidewalks because I tell my commissioners and people in leadership all the time, it's one thing to drive around, right? But you got to walk around to really see the issues because sometimes in the air condition you ain't smelling what's going on. There are places that we need like some cleaning out. You don't see the debris, the garbage because you're driving by so fast. And the state of the sidewalks, like my personal pet peeve, I tell Commissioner Gabriel all the time. All that dirt and silt that piles up on the curb, that blocks. If you have a wheelchair, you can't have an access because there's all that dirt and stuff piled up right when you get the on ramp and off ramp of the sidewalks. Like those things are important. And I never used to understand it until I was wearing a cast and I was disabled temporarily. Then you understand how important all these things are to mobility. So I'd like to thank you for your work on that. And yes, I will check up with Derek, Commissioner Gabriel, and make sure that we're keeping abreast of those walkabilities because we're doing a lot of streets and sidewalks and drainage.
Yeah, excellent, excellent. It's wonderful to see that in your second term and halfway through your second term, you still have great energy and great zeal for the work.
Yeah,
It
yeah,
was
yeah.
tangible listening to you last night. So thanks so much for that. But we have just maybe 3 more minutes left. Any parting words for the people of the Virgin Islands, and especially our older population?
Yeah, I just wanted to reiterate that, the inflation really troubles me. And I think whether you're older, or young, babe, just coming into the workforce, we need to really do a better job of planning what's going to happen in our life. And after, whether that's estate planning, which affects our abandoned and derelict buildings and the projects we're trying to work with there, or your life planning so that you make sure you finish your mortgage when you're before you're 60 years old. So that's access. When you have kids, how many kids you have, all that goes into planning. And then what happens if you get sick? If you are you insured? What sources of income you have in order to do that? Because unfortunately, bad things happen to good people. So as we go move forward, know that we're going to have to continue to challenge ourselves to figure out new sources of income. How do we get better skilled? And how do we make sure that our home is secure and we have some place to live as we age gracefully in this beautiful Virgin Islands? I want to thank you, Troy, and the AARP for your continued work and this opportunity to address people. Really, really good program. Thank you for keeping everybody informed and educated.
Yeah, and thanks. And you know, we are the continuous and constant advocates for the 50 plus population. And again, thank you so much for your responsiveness to AARP and your solicitude for the older population of the Virgin Islands. And we have a lot of work ahead of us. So get ready for 2024. We're going to be at your door a lot more often, doing a lot more. And we're so excited that very, very soon we're going to get that Commission on Aging going. I was having lunch recently with Commissioner Avril George, Human Services, wonderful appointee you have there. And I call her commissioner already. Well, she is, right? She's acting commissioner, but in my mind, she's already the commissioner.
Yes.
And and we look forward to working with her on the Commission on Aging and bringing that all together and addressing the needs of the older population. So again, thank you for all that you do for us, for the people of the Virgin Islands. Thank you for your dedication. I know it's not an easy job. And you're the lightning rod for everything, right? You get blamed for everything.
Absolutely.
When things are good, everybody else wants to praise, and when everything goes bad, the chief gets all of the attack, right?
All of it. All of it.
All
That's
of it.
okay though. We I built for it. That back is really broad. It's good. It's all good.
Yeah. Well, we're all humans, and we all need to work together. We're all Virgin Islanders, and together we can do it. Individually, we can't.
Absolutely.
So
Soar in
again,
24. That's the motto. Soar in 24. So looking forward to working with you and doing great things.
excellent, excellent. Thanks again so much for being on the show with us today.
Thank you. Take care. Bye bye.
Have a great day. Bye.